Hey everybody, it's Jeannie here, the Grizzly Granny, and I would love to have you come along with me on the ride today. We're going to be on the Cherry Creek Trail again, heading north. It's warm-ish here in Colorado, but it is very windy again. So I'm going to apologize ahead of time. We have done every possible sound mitigation on our GoPro and on our mics. So it is what it is. So let's ride, shall we? Gary's bringing up the rear, so wave Gary on the corner. Okay, here we go. Trying out a new microphone and GoPro. Trying out a new microphone and GoPro configuration. So we'll see how this works. I take no responsibility for any botched video or audio today. It's Monday, so it's going to be quieter on the trail, we hope, than yesterday was. Okay. So guys, how's your day going? You know, I think any day you wake up with a pulse, it's a good day. We have so much to be thankful for, no matter what's going on, right? Now you're going to notice I ring my bell on blind curves to warn people coming the other direction that cannot see me that I'm here. That's paid off many times, and it's a really good practice to get into. We have a lot of blind curves on this trail, and there'll be cyclists coming the other direction, 100 miles an hour. Well, really fast. Sometimes they'll kind of be in the center of the trail, or we'll have families that have spread out across the trail, or they have their pets and they've kind of spread out. So just a really good practice to get into on the blind curves. I am starving. Hi. It's around 12:30, 1 o'clock. I don't know. It's daylight savings time went off this weekend, so who knows what time it is. Anyway, I am starving Marvin, so Gary and I are going to stop at one of our favorite spots up here and get a bite to eat. Hi. Probably not the most healthy, but we have limited options on this ride. And I didn't have the ingredients at home to make our lunch ahead of time. So I wanted to talk to you guys, let you know about my new surprise diagnosis, which is still kind of in progress. I told y'all I had a near fatal heart attack in 2019, and I need to do a whole video on that because here I am, a nurse, and I didn't even know I was having a heart attack. Till right at the last minute I started to wonder, and I almost didn't go to the ER because the discomfort was in my back. I had no jaw pain, no left arm pain, no nausea, no sweating, none of the classic symptoms. Turned out my widowmaker artery, the left anterior descending LAD artery, that provides blood supply to the left ventricle of your heart, the pump, was 99% blocked. Now, at the time, I was eating vegan, which was really helping with my RA at the time. Just a moment. Passing on your left. Thank you, sir. Have a good one. One more. Non-smoker, fit and active, worked out, did all the right things, and man, if I'd have waited a couple more minutes at home, I wouldn't be here talking to you today. So, I have a funny little sound coming from my left tire that's new. Okay, we'll keep an eye on that. Anyway, let's get back to what just happened. So, as you guys know, I'm recovering from a back injury. And one day I was just looking through my imaging from the past few years. And various imaging. CTs that somehow included my lower lungs. And I noticed radiology remarks about infection or a scarring in my lower lung bases. Then I started noticing on other imaging that caught the lower part of my lungs, like CTs of my abdomen and so forth. They noticed a spot there, and I started looking down through the years at what radiologists had said about that, and you know, that thing was growing, it was getting larger. And so I thought, man, I need to get into a pulmonologist and see what's going on. Okay, give me just a sec. I'm going up a super steep hill here. Just a moment, I'll be right back with you. Hello? I think when I get up here at this next little there's a shelter, I'm going to stop, and Gary and I are going to take a look at my left tire, which is making a funny sound. Passing on your left. Thank you. And there's one more behind me. Thank you. I'm noticing that sound more when I'm going a little slower. So anyway, got into a pulmonologist. She did a complete workup, and she said that is not scar tissue from an old pneumonia or anything. That is a lung nodule, and it is growing. So she did a bunch more imaging and some pulmonary function studies, and took my information to a lung nodule board of physicians and said, we need to get a PET scan. So, to be continued shortly. Okay, so we checked out my left front tire, why it's making its little huffing noise, and everything looks good right now, so we'll just keep a close eye on it. Don't want to have tire problems today or any day, but we're prepared if something's going on with that. Okay, where was I? So, pulmonologist ran a battery of tests, and last week I had what they call a PET scan, P-E-T scan. And I'm sure most of you know what that is, but for those who don't know, It's like a CT scan, only they give you a radioactive sugar tracer, IV, and what that does is that is attracted to metabolically active areas in your body. So anyway, they did the PET scan, and that node in my lung lit up, and it lit up to a high enough degree. They have kind of standard values for how much they glow, and mine lit up so much that they're fairly certain that it is malignant. And so they're getting ready to schedule me for lung surgery. Now, next week, I have to go to the University Hospital for an all-day event, which involves history and physical, more tests, and then we take a lunch break. And during our lunch break, a multidisciplinary team of 20 physicians will be going over all of my medical history and all of my test results, all of my imaging and so forth. And then when I come back from lunch, I'm to meet with one of those physicians as well as my surgeon. An alarm to turn off there. And they will let me know what they think is the best course of action for me. Now, I'm definitely facing lung surgery. What they don't know is if they're going to do a biopsy prior to the lung surgery, or if they're going to go ahead and just do the lung surgery straight off the bat. May involve some chemo before or after, but we won't know that till they do some pathology on that lung node. So that is what is going on with me. And once again, I don't fit the profile. I'm a non-smoker. Now, my dad was a smoker when I was a kid, but you know, I'm 72 now, so I don't know if that really counts all that far back. I did find out the second most common cause of lung cancer is radon exposure. This is the first cause is smoking. The second cause, most common cause, is radon exposure, usually in your home. Now, our bedroom is in the walkout basement part of our home, and we had a radon test done once before, and it was normal, but it was just under the limit. Haven't checked it for a long time, and so as we speak, we're running a radon test to see what the radon is in that room. So we'll see what that radon test shows. As a young nurse, I was exposed to radioactivity when I worked with on an OBGYN floor in a university hospital, and we had quite a few patients that had radium implants. And back in those days, we wore a badge, but there weren't really tight controls on how long we were with those patients. And it depended on our staffing, you know, how long did it take to do their care for the shift. So we'll see, guys. Have to have an MRI of my brain this week because they said lung cancer likes to metastasize to the brain, has an affinity for that. So that's coming up in a couple days here for me. So I will keep you posted, but I told these guys, I said, look, I want to be out riding my trike. And I just started a YouTube channel, and I'm starting to get subscribers, and I do not want to lose my momentum, and I don't want to not be riding my trike. This is great exercise, as you know, for the heart, for the lungs, for your muscles, just any area of your body, really. Just a moment here while I check cross traffic. Okay, we're good. Coming into the area where our restaurant is. And so I'm out among traffic now. So anyway, they're not going to stop Grizzly Granny with this. And even if I have to do a video on a trainer, I have plenty of subjects to talk to you guys about. So no worries, not going anywhere. Give me just a second here to get turned. Okay, thank you. Sometimes people are very kind, and I so appreciate that, because it's kind of not the general way of behavior these days like it used to be. I'm sounding like a older lady, but back in the olden days, people were generally pretty nice and courteous. And you don't see that often, so when you see it today, it's pretty cool. Okay guys, we're gonna stop and have a bite, and I will be talking at you after we get done with lunch. Maybe I don't have any more to say, I'm not sure. But I'll try and join back up with you after lunch. Thanks, talk soon. Hi guys. So while we're talking about physicians, one of the problems we have today that we didn't used to have when I was a young nurse is that the right hand doesn't know what the left hand's doing. We have so many specialists. You can't just have your good old general practitioner anymore, who kind of oversees all of your care and coordinates it. You know, you've got a doctor for your bones. You've got a doctor for your nervous system. You've got your GI doc for your gastrointestinal system. You've got your rheumatologist, and you've got your neurologist, and you've got your OBGYNs, and none of them know what the other one is doing. The problem is, we are one body. Hi. We are one body, and we're all connected. We are not individual parts. They are all interconnected and interact with one another. So you need to be your own best advocate for your health care. And hopefully you are awake, alert, and oriented, because if you're not, you're going to miss something. And it's on our shoulders. If I had not pursued this and found that this nodule was growing on my own, nobody would have been looking out for that situation and said, hey, you need to get this taken care of. And that's not the first time it's happened. We've had many family situations now with health care and hospitalizations where if we weren't looking at medications and looking at treatments, things would have been missed. And we shouldn't have to do that in 2023 with our advanced healthcare system. You know, sometimes you can get so high tech. Passing on your left. Thank you. One more. We've gotten so high tech that we've forgotten that there's a patient in there somewhere in the middle of all this. And it's really sad. Passing on your left. Thank you very much, sir. One more. Okay, so the other thing I wanted to say was just take good care of yourself. Do the best you can. Always order copies of your lab results. Look those over. Order copies of your images. Look at them in your patient portals. Even if you don't understand the jargon, you don't have to be a medical person to just check it out and ask your physician about something that doesn't seem quite right to you. So I hope you've gained a little bit of helpful information today. Got a blind curve here, just a moment. And I'll keep you guys updated on what's going on with me. And do take care of yourselves. And I'll be fine. I've got a family that is close, and we pray for one another. And the good Lord's looking out for me. But I will keep you guys updated on what's going on. And hopefully I will be back out on the trail without missing much time because of this surgery. Okay guys, this is Jeannie, the Grizzly Granny, wishing you happy trails and be safe out there. Bye for now. Until next time. Oh, and if you liked it just a little bit, please like and subscribe, won't you? Bye-bye for now.